I just simply think that doctors should be held accountable, for what's happened. I mean, if you look at it, and I was fired as a patient from Dr. Buckmaster in 2023, and the doctor that fired me recently from the Franklin Medical, the Dr. DePriest, he's the one that came in the hospital in 2023 and told me that I was being discharged with a blood pressure of 186 over 116, and nothing was done, and my voice was slurred. There was something really wrong, and I believe was like, combined that stroke or TIA, whatever it was, and my gut messed up really bad. Backed up, a blockage, maybe a partial blockage. I still don't know, because I still haven't gotten a gastroenterology appointment to save my life. I went to Dr. Buckmaster. That was what I went to him for. First appointment, he put me back on the opioids and Klonopin. And that Klonopin didn't sit right with me. And I told him, And I believe what was happening to me right then when I had first went to him was I was taking that hydroxyzine, which is also a serotonin agonist, and I was having all sorts of symptoms and side effects affecting my gut because it's affecting the serotonin, and that's what causes, serotonin syndrome. So I was getting hyperthermic, which means overheated. You can see in my pictures, my face all flushed. Then I'd throw up, and my legs dystonic, cramping muscles, confused, foggy, irritable. He said in my thing there that I was irritable. Well, all of that is symptoms of the serotonin syndrome stuff. And when he put me on that Klonopin, I told him right away, that ain't working with me. I took like 2 doses and I felt suicidal, and I told him no, and I stopped taking it because I had already made a promise and a covenant with the Almighty that I'd never be a suicidal statistic. I would never do that, ever, because I had already went through a lot of that and what's wrong with me, and mentally just out of my head because of all these medications that I kept being put on. And let's try you on this, or let's try you on that. A lot of them, I think I was just downright allergic and intolerant to them, whatever they want to say about, so-called allergy, or that, no, it's not an allergy because it didn't, do something with the histamine to cause puffy eyes or a rash or hives, or any of the, clinical definition of, an allergic reaction. But anaphylactic shock is like the most extreme allergic reaction you can imagine. And he put me on Suboxone, and I was already having an allergic reaction to hydroxyzine. And he's telling, my daughter-in-law that I was on some unknown substance, he says, but no blood test. Like, I was contraindicated in every single way to never, ever, ever be prescribed that. My gut was torn up. I had just had a tooth extracted. I had all those symptoms I just described, which was a reaction to the hydroxyzine. And he put me on Suboxone, knowing that I'm like anaphylactic shock, life-threatening allergic reaction to morphine. And he wanted to argue that, that was just a pseudo-allergy because morphine allergies are rare. Well, I'm rare then, I guess. I don't know. But I had to go through all of that, and a TIA, stroke, however they want to define that. And I've got foggy, clouded spots on my brain now, and permanent nerve damage in my legs. This goes all the way back to like 2015 too, when the other doctor, Dr. Ruth Mills over at the VA Pensacola, put me on morphine, and I was already allergic to Dilaudid, and she sends me 15 milligram morphine. Well, I didn't know all of this, I figured doctors knew what they were doing. Everything it says on the sheets, they've looked at all the risks and deemed this necessary for your care. And I figured, well, even if the doctors didn't know completely, surely the pharmacy wouldn't prescribe multiple things that are contraindicated and not a good mixture with each other, and multiple serotonin medications, and, just unconscionable stuff. And I was on a whole bunch of junk medications when she sent me the morphine. And not a starter, like a small dose. It was 15 milligrams, a whole bottle of them, 90 of them, And I get it from all sides, because I'll get people commenting and getting mad at me. Oh, well, Dr. Buckmaster's helped me, has helped this, has helped that. No, you're just protecting your opioid drug dealer, So be real with yourself. He says he's going in there to pray to some entity, God, comes out and said, and I'm like, why is he prescribing me this Suboxone? And the nurse said, because it's an opioid that won't get you high and won't cause addiction. And I was confused and foggy and dystonic and all kinds of crap going on that I didn't know where it was coming from. And it was coming from the hydroxyzine. Once I got out of all of that incident and started studying it for myself, that's exactly what it was, because it has a common chemical with compazine. I'm already allergic to that. It's called piperazine, okay? There's a common chemical in both of them. And I asked the doctor that prescribed that, and she's like, oh, that's just a simple antihistamine. Harmless antihistamine. That was her exact words. It's just a harmless antihistamine. It has nothing to do with compazine. Just because they're spelled the same, there's no relation whatsoever. Well, yes, there is. And you need to study it a little more. And in fact, ciprofloxacin also has piperazine in it. And I just had a reaction to that. Just, not long ago, a couple weeks or so. Tachycardia in the hospital, 200 something over 135 blood pressure. And it's not a blood pressure issue. The blood pressure is a symptom of this, all right? And no doctor wants to deal with it properly and be, upfront with me on any of this. And it's just ridiculous to me. It really is. I don't even know why they're being like this. And it's really strange to me, because I remember a lot of the veterans out in Denver, 16th Street Mall, and they had similar stories. And they couldn't maybe articulate all the way, but they were saying some of the same exact things of what I'm going through now. And you should have seen them. They would just look around like paranoid, like somebody was looking at them, or, they were scared. And you think, I'm not. I'm scared too to come forward with a lot of this stuff. I really am. Because what's the outcome going to be? My life's been torn up for a long time because of this junk. And I never deserved it. Not one bit of it. Anyway, thanks for listening.